joining us today. I see that some people are still connected, so in the meantime, let me introduce myself. My name is Teresa Galera, and I am the Medical Manager at Bioscience. Welcome to this educational event organized by Bioscience in collaboration with ISAPS. Bioscience is a pioneer in the hyaluronic acid industry with an exclusive product rankings in monophasic and biphasic dermal fillers. We are the first manufacturer in the world holding the CE mark for both body and facial fillers. As a gold sponsor of ISAPS since 2019, we are driven to ensure the highest standard of patient safety and scientific excellence. Today, we are proud to bring you this live webinar, which we hope will be an insightful experience for all of you. We are increasingly seeing the combination of surgical and non-surgical treatments to provide enhanced results. In today's episode, we will try to deepen the knowledge on the body fillers and how to safely apply to gluteal augmentation. This procedure is highly demanded with an increment of 39% between 2018 and 2019. In this sense, body fillers are an alternative to be used alone or in conjunction with other procedures such as fat grafting. We will start with a testimonial about the ISAPS safety guidelines in aesthetic plastic surgery from our ISAPS special guest, Dr. Lina Triana, plastic surgeons and ISAPS president-elect. Then, we will follow with a demonstration on how to conduct a complete procedure carried out by Dr. Matt Stefanelli, plastic surgeon in Dubai and Paris. And finally, we will focus on how to prevent and manage complications associated to body fillers with Dr. Francesco Marchetti, plastic surgeon, member of the American Society of Plastic Surgeons, and expert of the Medical Committee of Bioscience. Before we get started, if you have any questions during the lecture, please type them in the question box on your GoToWebinar control panel. We will be answering some questions at the end of the session. If time runs out, our team will ensure that we get you the answer via email. Let's begin today's session with our guest, Dr. Lina Triana, plastic surgeons and ISAPS president-elect. We are so happy to have you today, Dr. Triana. Thank you for joining us.
Thank you. Thank you very much for your invitation and for this nice webinar that we're here for, all about trying to give the best knowledge, training, and experience for our doctors. So today we're going to talk about sharing my webcam. So today I'm going to talk about patient safety. It's important. It's important for all of us to know that regarding conflict of interest and disclosures to give today, well, as Melanie already said, we have a partnership with Bioscience. They are our gold sponsors. They have just signed again for 2022, and we're very happy about it. It's very important for us as the International Society of Aesthetic Plastic Surgery, for those that don't know who we are. We are the biggest leading professional body of plastic surgeons, and of course we're leaders in aesthetics. We're all about patient safety and aesthetic education worldwide, with more than 4,700 members in more than 170 countries, and more than 84 plastic surgery societies that are our global sponsors. And again, we do webinars, courses, we have the ISAPS Business School, publications, e-learning platforms, and many other advantages regarding patient safety, regarding aesthetics, and regarding patient safety, of course, mentorship programs, the biggest network, insurance for revisions, and of course, we also have accreditation for our facilities. So ISAPS and Bioscience have been working together to give the best regarding patient safety with fillers, and now with body fillers. So, you know, Bioscience is a leading brand with all the scientific experience about these body fillers. And that's how I want to present a little bit to you today. They're going to be just general guidelines. And I'd like to start saying that it's very important that we remember always why we're here, better serve patients, of course. And with this clear, today we're gonna, bioscience is gonna talk about all about the world of knowing about these injectables in body fillers for body contouring. And of course, it's very important also to get all of our technical skills, right? But we must never forget about our essence that is the best to our patients. And that's why plastic surgery was born, to enhance the quality of life of plastic patients, and that's what we're here for. It has evolved in all of what is aesthetics today or cosmetic procedures today, not only surgery, but procedures today, and that's why we're here, to give better alternatives to our patients. Today's world, everybody have no downtime, and of course, these non-surgical options with fillers and body contouring just seems the right fit in today's world. So, but it's important to remember that with the evolution of plastic surgery to cosmetic procedures, many say that we are just superficial what we do, and I believe that those that say that we are superficial is because they are really short-sighted. Because what do? We do what is best for our patients and enhance their quality of life. And having this in mind, remember I come from, those of you who know, I come from Cali, Colombia, South America, beautiful country, with the Pacific Ocean and the Caribbean Sea. And of course, we're Latin, and Latin women have big buttocks. And Colombia is the third country that does the most buttock fat transfers according to the ISAPS statistics. With this being said, it's important for all of you here, you're here because you have an interest in body contouring, in increasing buttocks, contouring size, and according to ISAPS statistics, buttock fat transfers were with vaginal rejuvenation procedures were the two procedures that increased the most in the past years in our ISAPS statistics. So this is something that more and more patients are asking for. Just not Latin patients, but patients all over the world, and that's why we're here today, and that's why bioscience is offering us these alternatives. So when we talk about safety, especially patient safety, we like to talk about 4 basic pillars, okay? And the first pillar would be the physician. Who is doing the procedure? This physician must always have the training, the knowledge, the training, and the experience in doing what he's saying that, or she's saying that is going to do to my patient, of course. And of course, the patient to be the right patient. That comes with our knowledge and our training to see which patient is the best candidate to which procedure, and of course, that has a good health for the procedure. The facility is very important. Remember, we're all about patient safety. That's why we offer to our members the quadruple ASF facility accreditation to make sure for our patients that we are having all the safety measures necessary for having a safe procedure. And the one that I believe is the most important one, and many times we forget about it, that is the treatment plan. And what is the treatment plan about? Why is it so important? Because we need to really listen to our patient first. And I don't mean only in the buttock procedures, but in any procedures that we as cosmetic physicians do. We need to first listen to the patient, and then as physicians examine my patient, and then between both of us, patient and doctor, we will do what is the right surgical or treatment plan for the patient in this moment. Because remember, one thing can be good now, but maybe tomorrow it will be better another one. So it's very important, not only our knowledge and our skills that we come today to get through the webinar that has been planned by Bioscience, but also to listen to the patient so that we really deliver what she really is expecting. And decrease false expectations. And here in the treatment plan also enters what materials we're using. And here it's very important for all of us to use, for example, in the case of fillers or anything that we're using for doing this treatment in my patient, that we make sure that have all the scientific knowledge, all the scientific basis, so that we can really be what we say is a safer procedure. We can never say that we have zero risk of complications, because that's just not true, right? We come here to get the best knowledge. We come here to improve our skills, but we can never promise a patient that there will be zero complications. Of course, the more and more that we have done procedures, the more and more that we have this knowledge, experience, and training, the more and more, for example, us plastic surgeons that come from a reconstructive basis, we will have more tools to better approach a complication. But still, they will come, and we just need to know that they will come. But the important thing is that we know how to better deal with it with the best tools that we can ever have. The more knowledge, the more experience, and the more training, the better we will be prepared for previous complications. And if anybody comes to us and tell us that they have never had a complication, there can be one of two ways or sides of the story. The first one will be, well, this guy or this lady doesn't do much the procedure. The second one is that definitely he's a liar. So the best thing we need always to have in mind, and that's how I want to start and finish this presentation about patient safety, is why we're here for, to better serve our patients. So thank you very much, and I invite you all to come to our Vienna meeting, Permanent Congress, that is this September. And of course, for those that are plastic surgeons who join ISAPS, and for all the ISAPS staff, we have our ISAPS Business School, and we have a membership for all of these people that help us in the office and that make possible to have a successful practice. Thank you very much.
Thank you, doctor, for sharing your experience with the safety guidelines. May I ask you what specific guideline will you give for gluteal augmentation using hyaluronic acid fillers?
Well, I say that the best would be to keep on with ISAPS guidelines, the one that we have been sharing with you by the science, and the one that, like the video that you're preparing, that have all the safety guidelines that you're following in the video. And of course, although we're talking today about a non-surgical option, that is the fillers for body contouring in the gluteal area, it's important to always remember what we have in the background. As ISAPS, we have worked with ISAPS and together with the American Society of Plastic Surgery and the American Society for Aesthetic Plastic Surgery, and we did a big study regarding safety with buttock fat injections. And of course, we're injecting now hyaluronic acid to the buttock, so it will be a good idea to just have in mind those safety guidelines that we did for the buttock gluteal fat augmentation. Although it's not the same, because we're talking with small syringes and smaller quantities, still it's good to have a look at those guidelines. So I invite all this audience, go ahead and Google our ISAPS guidelines for buttock augmentation, fat graft augmentation, and we can also have a good base for patient safety. Thank you.
A good advice, for sure. Thank you, Dr. Triana. It was a pleasure having you with us. Now, let's move forward to the demonstration of safe gluteal augmentation with Dr. Max Stefanelli, plastic surgeon in Dubai and Paris.
Good morning, everyone. I'm Dr. Matt Stefanelli, French plastic surgeon with a double practice in Dubai and Paris. Today, I'd like to present you my lovely patient, Rada, from Russia, and Rada is 39 years old, and we are going to perform on her a butt filler augmentation. As you can see, Miss Rada is a skinny patient. She's 172 centimeter for 55 kilograms, and she has already a good shape, but regarding the butt, she aimed to have a little enhancement. When it comes to the assessment of the buttock for any procedure, surgical or non-surgical, we need to assess the patient in a standing up position from the front, from the side, and from the back. As you can see, we start the assessment of the buttock region from the front. Why? Because we want to assess the presence or no of hip dips. In this case, you see that there is no hip dip on the left, a little bit on the right, but actually this is not the concern at all of Rada. Then we ask the patient to turn 90 degrees and to lift the arm to appreciate the projection of the butt. She's okay with the projection, but actually her main concern is a lack of volume in this region. I like to divide the butt in three regions: the hips, the lateral butt, and the medial butt. The medial butt will give definitely the projection, and Rada is okay with that. She's really concerned by this depression, which is in between the medial butt and the hip. So we are going to enhance this region, the lateral butt, with filler. And now we have the patient to turn 180 degrees, and we will see the vision from the back. You can see again here this lateral depression in the butt, a little level of hip dips, but again, this is not our concern. And on the other side, again, this lateral butt depression. I like to finish with some anatomical landmarks. First of all, the grid trochanter at the level of the hip dips, then the ischial tuberosity at the level of the infragluteal fold, the posterior superior iliac crest at the level of the waist, and finally here, the sacrum, and especially here, the sacroiliac joint, which is forming the sacral dimples. And finally, I like to divide the butt in 4 quadrants: a vertical line passing by the midline of the butt, and a horizontal line passing by the half of the intergluteal cleft. As you can see in Rada, she's really concerned by the lateral butt, lateral to this midline line, and not so much by the medial butt. So we are going again to perform butt filler injection in this lateral butt area. And finally, it's very important to assess 2 elements. Number 1, the thickness of the soft tissue. We do that with the pinch test, and you can see here we have a good 5 centimeter pinch test, which is ideal, and also the skin elasticity. And you see that when I'm stretching the skin, actually this is not sagging, not stretching too much, so this is also a very good indication for fillers. We are done with the assessment, and now we are going to start the markings. I like to make 3 types of marking, and I will use 3 types of marker. Number 1, the anatomical landmarks in black. Then I will use the blue marker for the injection area, and finally the red marker for the entry point for the cannula. Let's start with the anatomical landmarks. First of all, I like to divide the butt with some lines. The first line is actually a horizontal line passing by half of the cleft, and we are going to mark this with some dotted points. It's particularly relevant when we inject the hip dips, but as I said before, in Rada we are not going to inject the hips, just the lateral butt. The second line is passing by the midline of the butt, and very often the midline of the infragluteal fold. So in this case, we can see that this line is here. And the last line that I like to show you a little bit from 3/4 is dividing the lateral butt from the hips. Here I can easily palpate my grid trochanter. So I like to make a last vertical line passing by this trochanter. As you can see in this lateral butt, we have the upper, central, and lower parts. She has a good volume in the upper part, and also in the lower part, but definitely she's missing volume in the central part. So I'm going now to divide this lateral butt in 3 zones, upper, central, lower, and we will focus our treatments in the central one. I'm now drawing the defects, which is again the lateral central butt, not the medial butt, not the hips, not the upper butt, not the lower butt, definitely this region. Now I'm going to mark the entry point. I like to do for every zone 2 entry points. Why? Because I like to cross my thread of filler. In this particular case, I like to start with first entry points here, medial to the defect, and another one above the defect. This way I will be able to have 2 directions for my thread and to have, crisscross nets. And finally this one. I like to summarize. We are going to inject in this blue zone, corresponding again to the lateral central butt, Yacob MLF2 through these 2 entry points, medial and upper, using an 18 gauge cannula, and we will cross our thread. So we did the same markings on the other side, and as you can see, it's a little bit asymmetrical because the defect is not the same. You see here it's a little bit shorter, and on the side we extend a little bit in the hips because she has some degree of hip dips on the right. So I like you to appreciate the difference between the right side and the left side. Can you turn a little bit? You see here, we didn't go in the hip dips, but it was a little bit higher, this zone, and on this one, it's a little bit shorter, but we extend a little bit on the hip. So this defect is more, let's say, horizontal, the other one is a little bit more vertical. So now we are ready for the procedure. Let's go. Today we are going to use for our patient Hiacob MLF2. Hiacob is a body filler made of a long chain of hyaluronic acid. There are 2 types, MLF1 and MLF2. MLF2 has bigger particles, so it's more adapted for the hips and the butts. Hiacob is made in Germany by Bioscience and has a CE mark, ensuring a very high quality and safety. What are the advantages of Hiacob? Number 1, it's a non-surgical procedure, non-invasive, so the downtime is very short. Number 2, the safety. This product has been shown to be very safe, both in my practice but also in the numerous studies about it. Number 3, the efficacy and the satisfaction of patient. Again, very high. And finally, the immediate result. The patient is able to see the result just after the procedure, and they like that very much. So Hiacob body is coming in 10 cc syringe, which has been shown to be the perfect volume. Why? Because 1 cc syringe, like for the face, is not enough for big volume like the butt, and 30 cc syringe will be too much. So really 10 cc is the ideal syringe volume. When I perform a Hiacob injection, safety is my priority. To ensure the best result, I follow the ISAPS, International Society of Aesthetic Plastic Surgery protocol. First, patient selection. Who is being treated? We should be sure that the patient is above 18 years and is properly consulted and asked about their medication or allergies. Then, second point, who is doing the procedure? For this treatment, it is crucial that a physician or a specialist who is trained in this procedure, product, and anatomy is going to carry out the treatment to minimize any risk of complication. Third point, where are we doing the procedure? This treatment must be carried out in an appropriate aseptic room with a proper lighting and all required tools. Complete sterile draping should be done. The cannulas and Hyacop syringe should be also prepared in a sterile environment by personnel dressed in scrub and wearing sterile gloves. Once all these safety guidelines are in place, we can move on the procedure. So we just move now to the treatment room, and I'd like to show you again the picture of my patient in different positions, front, side, three-quarter, and back. And as you can see, we are going to inject in the lateral butt depression, not so much in the medial butt nor in the hip dips, but definitely in this lateral butt between the hips and the medial butt. Now I like to show you the surgical table. We are in a very sterile environment. We have the sterile drape, sterile gauze, of course, the antiseptic. And now if we get closer to our tools, we have the syringe of anesthesia, which is xylocaine with adrenaline, and a 30 gauge needle, then an 18 gauge needle for the entry point of the 18 gauge cannula that will serve to inject the Yacob MLF2 syringe. We plan for this patient 16 syringe, so it means each side will receive 8 syringes, so a total of 80 cc. So we are going to start the preparation of the patient. The first step is, of course, to do the disinfection. We are using chlorhexidine alcoholic in perfect condition. We do the second side. So now we are going to use this sterile drape with 2 holes, 1 for each butt. We are now ready to start the procedure. We start by the anesthesia of the entry point. Again with a 30 gauge needle, xylocaine adrenaline. This one too. Okay. Now needle 18 gauge. So this side is a little bit different than the first side. We have a less, let's say, vertical defect and a more horizontal defect. And we are going to use these 2 entry points, this one in particular for the muscular part and this one for the medial part. But then we also do this crisscross network for stable results. So we start deep by pinching the butt. I'm on top of the muscle. Another one deep. stretching the skin like this. Okay, we are going now to change the entry points. Let's start the second entry port. You see that I'm going to reach now easily these parts. This is more a little bit the hip dips. This is here the lateral butt. She has an asymmetrical effect. So first of all, this injection is deep. Now the tip of my cannula is here. It's very important to choose entry holes that are not too close where you inject, so always outside the injection zone, but also not too far. So this is 10 centimeter, and this cannula is also 10 centimeters. So this is the good length. Just in case you are a little bit short, you do this socket maneuver here. Okay, so we are 6 now. I will take another one, 7. Probably need to be here. You have to take care of the transition zone. When you inject in a zone, then you have to make a smooth transition with the surroundings zone, not to be visible. And I like also to come back a little bit to my lateral butts to make some crisscross injection. Okay, I like to check patient in a standing up position. This is very important to always keep 1 or 2 syringes each side because we might have some bad surprise. The result might look good now, but when she will stand up, maybe there is a little bit defect here or here or here. Before to do that, let's massage a little bit. It's very easy to mold this product. It's not hard at all. There is a very good integration in the tissue. So we finish with this first side, and we are going to move to the second side. Okay, so at this stage we finish 7 and 7 syringe each side. So actually we didn't finish the procedure. Why? Because before to finish the number of syringe, I always like to check the patient in the standing up position. And we are able to see the irregularities or the, let's say, the remaining depression. So if we start on the left side, you are able maybe to see that we inject the product mainly here, and therefore here there is a little bit of product missing. So I'm going to mark it in a standing up position. This way after we can complete that. On the other side, it's a little bit more obvious. We definitely need some products here, and even more anterior. We plan only to treat the lateral butt, but when we treat the lateral butt, it's very common that we need a little extra in the hip disc. We have this little depression. So you are able to see the markings of the additional injection we are going to do. And I like to mention that in this particular case, and this is a really adaptation, I will choose an additional entry point to fill nicely this banana shape defects. And on the other side, we have more or less the same. Another entry point that will be here, and I will be able to reach this defect through these two entry points. So it's very important, you see, to check the result in a standing up position. And I'm going to go even further by doing the touch-up in standing up position. Of course, I need my nurse to come in and to help me to get the same sterile condition. I will have a special focus on the entry point, of course. I'm going to do the anesthesia. Can you tell a little bit of this new additional entry points? I will do the same on the other side. Turn, my dear. We will need less products, probably 1 or 2 syringes, not more. Okay, so we finish the treatment. I like to summarize everything. We did, first of all, on the laying down position, 7 syringes on each side, and then we asked the patient to stand up for the touch-up, and it was, I think, very useful. We injected another 3 syringes on the right, and another 2 syringes on the left. Total 9 syringes, 90 cc on the left, and 10 syringes, total 100 cc on the right. I'll let you now appreciate a little bit the results. We inject mainly in the lateral butt, not so much in the medial butt, and not so much in the hip disc. So I like my patient to turn a little bit 3/4, and you are able to see now the result on this side, and even more when she's turning. Of course, we didn't inject the medial butt, so the projection is not so increased, but there is a more fullness and roundness in this lateral butt. Let's go on the other side. You see now on the 3/4 view the injection in the lateral butt, and also in the hip disc, because there was a little bit of hip disc on the right side. Total 10 syringe. As you can see, it's absolutely possible to inject the patient also in a standing up position. And this is really a good way to avoid a bad surprise, after you finish the procedure in a laying up position. And the patient said, oh, look at this, look at this, look at this, look at this. It will be disappointing, it will be a little bit too bad not to check before to complete the treatment. So thank you very much for your attention, and thank you to my lovely patient for her patience and braveness. Are the before and after care when performing Hayakot. Before the procedure, I like to advise my patient to avoid alcohol, smoking, medication, and also hair removal treatments. Just after the treatment, this is very normal for the patient to experience some degree of tenderness, swelling, even bruising, but usually it resolves in a couple of days. However, to help the recovery of my patient, I like to give them some recommendations. Number one, to apply some ice pack on the injection zone. Number two, arnica, both topical and oral. Number three, painkiller, but usually it's not very painful, maybe 1 or 2 days. Number four, antibiotics. Even if we did the procedure in a very sterile environment, I want to avoid absolutely any type of infection and biofilm, so 1 week of antibiotics. Then, regarding the massage, just very gentle massage if they feel a bump, otherwise not too much to avoid any migration. And finally, to avoid intense activities, intense heat like long shower, sauna or hammock. During this procedure just done, I can really confirm that the application, the injection of IACOP is very smooth. The treatment duration was very short, half an hour approx. And finally, I can really ensure you that the patient very happy, very satisfied, and so do I. Thank you very much.
This demonstration was highly requested in our previous webinar, so I believe it answered most of the questions that you may have. If you have any additional inquiries, please feel free to type them in the question box on your GoToWebinar control panel. We are curious to know your thoughts on the use of body fillers in your daily medical practice. Therefore, we have prepared a quick poll that you should see appearing now on your screen. I will give you a few more seconds before moving on to our next question. So it seems that most of the audience does not have experience in body filler but is interested in learning. Let's move now to our second question that will appear right now on your screen. Just a few more seconds. The most selected answer is less than 30%. Good answer. Next, I would like to invite Dr. Francesco Marchetti, plastic surgeon, member of the American Society of Plastic Surgeons and an expert of Bioscience Medical Committee, to enlighten us on how to prevent and manage complications related to hyaluronic acid filler. Welcome, Dr. Marchetti. Thank you for being here with us. The floor is yours.
Welcome to Rellenos and welcome good evening to all the participants to this webinar. Thanks also for ISAPS to join us and to let us show this important topic when we were talking about complication associated to body filler. We are now known that there are two types of complication usually associated with body fillers. In the first categories, we can talk about an immediate adverse reaction. That is including itching, reddening, sensitiveness of the area, swelling, hematoma, hardness, and hypersensitivity reaction. These complications are common and usually of mid severity. They can occur during the first week, even immediately the procedure, and also they could be solved between 1 and 2 weeks. As regards the second category, we are talking about the delayed side effect. And between this big complication, we could have, for sure, bacterial infection, the biofilm formation, nodules, reactivation of herpes sometimes, filler migration, necrosis, or the foreign body reaction with granulomas. We can say that these adverse reactions are rare, but they may be moderate and severe. And there's not a specific timeline, just for the appearance of or resolution. As we can see, here we have some nodules, and there are one big nodules with 2 little lumps in the lateral part of the buttock. In a patient that was treated by an inexpert injector during a training. As we will see later, I will show you why this can occur. In the other hand, this is not a patient of mine, but a patient coming to my observation after this big reaction. This is a reaction after using a hyaluronic acid, but not CE certified, that has multiple nodules all around the buttock area, and as you can see also, some of them are infiltrating the muscle. Here are 2 other pictures where we see 2 patients treated with body fillers also for the hands. We know that these kind of fillers are really useful for hands because we got 10 cc syringes, so usually we can share it on the 2 ends, and we can for sure achieve really a good result without using so big quantity of product. In the left side, we saw the swelling of an end after the procedure. In that case, it's just it's not a nodule or granulomas, so it's swelling, and with a cortisone gel, we could after 2-3 days we could easily solve the problem. In the other picture on the right side, we saw multiple nodules that we had to. This is an adverse reaction delayed, and we had to inject it with hyaluronic acid to solve this problem. Here we have one more picture. The courtesies for Dr. Piero Gabbai, that is our main doctor in Bioscience Committee, where we can see how there's this kind of herpetical reaction because the practitioner inject really too superficial, just really below the skin. How to manage and how to use with a good safety this kind of tools. After the procedure, I usually, in a normal situation, conduct the first follow-up after 2 weeks in order to assess and manage all the potential adverse reaction, and also to analyze the result with before and after pictures, and just also talking with the patient and understanding how the treatment goes when in the days. Sometimes, in the case we have an immediate adverse reaction, if we have it, the patient, for sure, we cannot wait 2 weeks, but we have to contact the patient, stay in contact by phone, and also in my practice, I used to follow up in after 3 days, and then 3 days by 3 days for 1 to 2 weeks at least. With the bioscience and the other member of the board, we conduct last year a post-market planning trial using the body filler for lactose augmentation. I want to share with you and with all the audience the result that we got in the studies, and all the results are taken in terms of safety. We average injected MLF2 product in the buttocks. We took the number of 35 patients and performed follow-ups of up to 6 months. The most common adverse reaction that we observed are the swelling, with an incident rate of 0 to 29, pain and an incident rate of 0 to 20, and the reddening with the incident rate of up to 0 to 17. If we get swelling reaction, we can treat with benign topical cream. For pain, usually I used to give the patient ibuprofen, 600 milligrams each 8 hours at least for 3 days. In case of reddening, my advice is to wait just the resolution, because it's not an adverse event but just a side effect. From my experience, after the PMCF for sure, I would recommend not to use toradol in the management of pain, but just ibuprofen as painkiller. It's also important to avoid use hyaluronidase in the early innings. Why? Because it could be just a transitory effect. So hyaluronidase could also give inflammation. So we have to wait, observe, we have to do observation and see what happens. Then we will use all the tools that we will show you later. In my practice, I never use corticosteroids in the early events. As regards the delayed adverse reaction, otherwise I would recommend this kind of treatment. If we have migrational lumps, my suggestion is to use hyaluronidase for 1 units every 1 C injected to revert the reaction. If we have severe lumps without infection, we can treat it, the acute response, with steroid tablets up 10 milligrams during the 3 days post-treatment, and ibuprofen twice a day, always 600 milligrams. When finished the acute reaction, we can use, for sure, hyaluronidase, but up when the reaction is stabilized. If we got infected lungs, my suggestion is otherwise antibiotics and ibuprofen twice a day. Also, for it could last the therapy with the painkiller up to 7 days. If we have nodules as an early event, sometimes we can smooth it with injection of saline, but you have to be super skilled for sure, because you have to avoid to inject if you are not really sterile, and if you don't understand where to put it. If we're talking about granulomas, my advice is to inject steroids from 10 units to 20 units inside the nodules, and take like pills, the ibuprofen twice a day. If we have infection, we will inject with steroids, but we need to take also antibiotics up, sometimes also to 3 weeks. With major infection, and if we have big, for sure, purulent reaction, we have to manage with surgical drain sometimes. And sometimes it happens if we wait too much in treating granules. It's important to know how to manage complication, but the most important thing is to prevent them. And in my experience, also going all around the world, training a lot of doctors, the most important factor that can help you to avoid this kind of situation and all the complications we are treating in the previous slides is to, maybe the most important thing is to train in the right way. The injector has to know the appropriate level of injection and has to build the appropriate experience in how to inject. It's really more important the knowledge of what you are doing and also the knowledge of the product you are using. And above all, the last but not the least, for sure, the injector has to have the anatomical knowledge of the area he is treating about. We know that talking about buttocks, the really important things also made by Costantino Medieta is the classification of the butt, is so you can understand, how Dr. Stefanelli showed us in the previous video, how to inject depending on the shape at the beginning. It's really also more important to avoid the lower area because we can increase the weight and this kind of asymmetries or incorrection of the area we have to treat it maybe by other treatment. The effect of the gravity and the weight worsen for sure the result instead of improving it. One important thing is for sure the injection technique, but also the quality of the product. In fact, we have to choose the right product, a CA product like Corporales, and today is the only one on the market, and that has this main characteristic that is HA, so it's natural and resorbable, is really, really safe because the PDTA levels are endotoxin are not so high. And also because it is biphasic, has really a good duration. And as I underlined before, is CA mark and ISO mark. Really important, this is MRI that I take from a patient treated during a workshop here in Italy, where in the left part, the injector injects too superficial, so now you can see why the nodules can develop. In the other side, we inject in the right part, so we inject down to the scapula fascia, just up to the muscle, and we don't have any adverse reaction, any nodules, any lump, and the area is really, really soft. This is really important. One more important thing is that the cannula to use, as Dr. Stefanelli showed before, is a cannula 18G. Why we don't suggest to use 20 or 16? 20 because it's really thin, and injecting with this kind of cannula could be really hard, also for unexpected practitioner. In the case of 16G cannula, the risk is to the product will flow too easily. So the risk is to have a lot of lumps because we cannot direct in the right way the injection. Avoiding always the adverse reaction, we have some recommendation as regards anesthetic, where the use of lidocaine is to use little amount of lidocaine just in the entry point, because you don't need to, this is not a treatment that is where the patient has a lot of pain. and also before the lidocaine could deform and change the shape of the area you have injected. We strongly not suggest to mix lidocaine with the filler. You have only to open the filler, maintain the sterility, and inject. Maybe one of the most important things is the average of the volume injected. Injecting high volumes, more than 10 vials per side, can cause a really adverse reaction because the big inflammation could lead to have a lot of nodules and granulomas in the area of injection. My recommendation is to inject maximum 10 vials per side in a session, maybe from 2 to 4 weeks, it depends on the patient, and then proceed with the second step or proceed with touch-up. Also, very important is the consideration regarding the lifestyle that the patient has. Exercise could create for sure redness or hardness of the the area treated. I got a patient with really strong exercise gear where she developed really a big inflammation that I had to treat with painkillers and corticosteroids, and I solved the situation in 3 months. So really avoid to be or to strong exercises, especially in the first 15-20 days. Also, smoking could be in hard smokers could average the complication after all the filler procedure, above all after body filler disease. We are talking about malformation. I also want to highlight the importance of the patient selection, as told before by my colleagues, when you are choosing to treat them with body fillers. In order to decrease the risk of adverse reaction and of unsatisfactory result, we have to avoid the patient with severe skin lashes, and we can see how to avoid it with the stress test, with poor tissue covering, and we could see how we can avoid with the pinch test, and also with the doses of the lower third in the gluten. This is really the 3 key points to avoid the bad results. When we are talking about stress test, we are talking about using, like we do for breast augmentation, sometimes a caliper, we measure the mark distance of 3 centimeters, we stretch the skin, we remeasure it, and we measure the stretching distance. If the distance of the skin increased by 50% or more, the patient has too much laxity and the treatment is really contraindicated. The same is for the pinch test. If the skin fold is less than 2 centimeters thick, the tissue covering is inadequate for the treatment with body filler, so I don't suggest you to use it. Just to conclude and to summarize all my discussion is that there can be common immediate adverse reactions that are easily managed and moderate severe delayed adverse reactions that are rare, but we have to manage. So we have to focus every time we treat the patient with body filler, and every time the patient chooses a doctor who have body fillers, we need to have trained injector, we need to have the test product, we need to have an adequate injection technique that is really linked to the training of the injector we are talking about, and above all, we have to focus on a good patient selection, considering all the lifestyle and all the things that are 360-degree all around the patient. Thank you so much, and I give word to Teresa.
Thank you, Dr. Marchetti, for the lecture. As we are running a little bit late, I'm going only to ask you one question from the audience. So Dr. Smith from United Kingdom is interested to know why swelling may appear in patients with body fillers after the COVID-19 vaccine, and if it happens, what will be your recommendation?
My recommendation for sure is to avoid with this now with this problem with the vaccine, to avoid injecting up to 15 or 20 days before and after the vaccine for sure, because we are talking about macromolecule and try to solve this kind of situation with corticosteroids, but we know that it's just a swelling because of the immune response. So we have also to wait the vaccine to do its job.
Very interesting indeed. Thank you for the answer, and we will be replying to all your questions by email in the following days. I would like to thank you again, our experts, Dr. Marchetti, and our guest, Dr. Triana, for participating in today's session and contributing with the valuable input. The recording will be published in Bioscience YouTube channel. If you would like to discover more, we invite you to follow Bioscience in Instagram. We hope to keep in touch with you for more educational events regarding dermal fillers based on our long heritage and of high safety. Thank you and have a good evening.